problem because it is a potent risk factor for non-communicable diseases. They are major contributors to premature deaths, and they are increasing dramatically in the region. Compiled data for adults aged 15 years and older from 16 countries show alarming figures. This is from WHO 2010, showing from selected countries the prevalence of obesity for a BMI greater than 30 kilograms per meter squared in different countries of the region, being highest in Saudi Arabia and lowest in Lebanon. Another figure here, a table from, again, a recently published paper showing the different age groups in adolescents and adults, males and females, and how the figures are really very high, especially in the Gulf region. And this is showing the differences in the Gulf region, but they're really high, obesity and overweight and obesity in the different age groups. So it's higher in women compared to men. Overweight is higher in men, but the trends are both going up. And the difference is, although there are many causes or contributing factors, but of course, marriage and childbirth is one of the strong contributing factors. But the major concern is the escalating level of overweight and obesity among children and adolescents. It's interesting that this paper is showing the estimate of mortality of cancers, cardiovascular disease, and diabetes in Arab countries according to the per capita income. And of course, when you look at the figures, the lower per capita income countries don't differ much in the three: cancers, cardiovascular disease, and diabetes, compared to the high per capita or the middle per capita incomes. And we heard this morning then that underweight or undernutrition, whether it's maternal or for the fetus or infant, it is related to non-communicable diseases. So probably this is one of the factors why we see higher figures in the low-income countries. So it's no more problems of the rich countries. Foodborne diseases in developing nations, they are a primary cause of malnutrition, adversely affecting the growth and disease resistance of infants and children. In many countries of the region, and as a result of the economic difficulties, inadequate medical care and/or lack of health insurance, medical attention is not sought, making accurate reporting of food and waterborne diseases very difficult. Strategies and action plans addressing food safety issues are developed, but foodborne diseases still pose a very serious threat. Sorry, okay. Diseases of zoonotic origin and salmonellosis and campylobacteriosis are the most common reported foodborne illness diseases. The causes, especially in rural areas, are of course lack of hygiene standards and control measures in food preparation and the use of unsafe water or polluted water. There is intersectorial collaboration in some countries, and it led to the establishment of food and drug administrations or interministerial committees. So we come to the focus of the strategy, the country nutrition profiles. So countries of the region differ in their capacity and potential economically, politically, socially, and demographically, because they are witnessing significant changes which may complicate the situation even further. And as such, they've been divided into 4 groups or country clusters regarding nutrition strategies and dominant nutrition problems, major risk factors and underlying causes, program interventions and gaps in response to these problems, and finally, enabling environment factors for improved action. And the groups have been categorized as countries in advanced nutrition transition and countries in early nutrition transition, countries with significant undernutrition, and countries in complex emergency situations. And of course, some countries appear in more than one group. And the aim of this categorization is to provide a summary tool to capture commonalities and differences among them, and to guide strategic planning and the development of nutrition policies and programs at the regional and country level. For those in advanced nutrition transition, they have high levels of overweight and obesity. They have moderate levels of undernutrition and micronutrient deficiencies in some of their population groups. And they include countries like Iran, Tunisia, all members of the Gulf Cooperation Council, except for Yemen. And then there's countries in early nutrition transition. They have moderate levels of overweight and obesity. They have moderate levels of undernutrition in specific age groups. They have widespread macronutrient deficiencies, and they include Egypt, Jordan, Lebanon, Libya, Morocco, Palestine, and Syria. And then there's countries with significant undernutrition, and these countries have high levels of acute and chronic child malnutrition. They have widespread macronutrient deficiencies and emerging overweight, obesity, and malnutrition of affluence in certain socioeconomic groups. They include Djibouti, Iraq, Pakistan, Yemen, and some subgroups in GCC countries, Iran, Palestine, and Tunisia. And those in complex emergency situations, of course, they have severe child and maternal undernutrition and widespread micronutrient deficiencies. And they include Afghanistan, Somalia, Sudan, and I think we should include Yemen also here. But there are current responses and challenges that have been seen in the region. For example, in the Middle East, in the MENA region, UNICEF reported in their report of 2006 that 6 countries were on track to meet the Millennium Development Goals, targeting reduction of underweight children under the age of 5: Djibouti, Jordan, Oman, Palestine, Syria, and Tunisia. And there are 12 countries who have contained underweight prevalence rates below 10%. 6 countries were on track to meet the Millennium Developmental Goals, and they're Afghanistan, Iraq, Pakistan, Somalia, Sudan, and Yemen. Nonetheless, following the economic crisis of 2008 and the recent political unrest in some of these countries, the overall proportion of underweight and under 5s continues to rise, and the nutrition situation of infants and children under 5 is thought to have further deteriorated. So the region suffers from absence of clear political commitment for nutrition action. There's absence of a policy framework and institutional capacity to plan, implement, and monitor sustainable nutrition programs. There's chronic conflict and natural disasters. In addition, there's disproportionate allocation of health budgets. There is absence of nutrition expertise in related sectors, as well as lack of intersectorial coordination. There are other factors involved, such as food safety issues, changing lifestyle patterns, decreased food production and availability, food distribution, which affects supply, safety, and most importantly, price, the media and its effect on food choices, urban design to encourage and promote healthy lifestyle behaviors, and of course the problem with television viewing and computers, especially in the younger age group. So the Regional Strategy on Nutrition 2010-2019, its goal is to improve the nutrition status of people throughout the life cycle. Its aim is to support countries in establishing and implementing action in nutrition according to their national situation and resources. And the purpose is to improve the nutritional situation of the people in the region by encouraging countries to reposition nutrition as central to their developmental agenda. It should provide a framework to help countries decide what nutrition actions and that are appropriate nationally. It will support member states in identifying, developing, prioritizing, and adopting nutrition interventions that will help achieve MDGs 1, 4, and 5. It will address the emerging issues of obesity and diet-related non-communicable diseases. So finally, the objectives. Number one, to increase political commitment and enhance nutrition assessment, monitoring, and evaluation. To reduce the prevalence of wasting and stunting among children, especially children under 5 years of age, and of undernutrition among women. To reduce the prevalence of micronutrient deficiencies. To reduce the prevalence of diet-related non-communicable diseases. To build capacity, very important part, continuous training for nutrition emergency situations. To improve food safety, and to ensure a safe, healthy, and sustainable food supply. I just wanted to say that this problem we are facing, all of us, I think I can speak for all of us, political commitment is lacking. You try your best to reach decision makers and to let them, these are the problems, but we lack statisticians, we lack economists to give us figures, because money makes a big difference in the decision making of adopting policies or implementing plans. And you try so hard to reach the decision makers, and sometimes you don't find them, or they just shake their heads for you, but nothing is done. I'm so happy that at the moment EMRO is trying very hard to, for example, the scaling up of nutrition is coming up on the agenda, and we are meeting soon, but we just hope that it will be taken seriously this time. This strategy document is online. Each objective I just mentioned has a list of plans of actions, and it is where it is suitable and adaptable to the one country in the region, that they can implement the different actions they can take to address the issues of priority at the national level. Thank you very much.